Press your thumbnail hard onto the index finger of your other hand until the nail bed turns completely white. Release it and count the seconds until the pink color returns. If that took longer than 2 seconds, your heart may be sending you a signal your doctor has never pointed out. Most people assume heart disease announces itself loudly. Chest pain, a sudden event, something unmissable. That is the version that reaches the emergency room. The version that builds quietly for years before that event leaves signals throughout the body, including in the hands, and almost no standard appointment includes the time to show you where to look. There is no billing code for a hands examination that walks you through 8 documented cardiovascular indicators. What follows does exactly that. We are going through all 8 signs, and I want you to stay for sign 8. It is backed by the largest cardiovascular study ever conducted. It involves no equipment, and most people who discover it wish someone had told them years earlier. Subscribe to this channel before we go through the list. This is built for adults over 60 who want to understand what their body is telling them before it becomes an emergency. Every person who joins makes it more likely the next person who needs this finds it in time. Subscribe and let's go through these together. You have probably looked at your hands thousands of times without knowing what to look for. You have noticed the veins becoming more visible, the skin thinner, the grip not quite what it was 5 years ago, and put all of it down to the expected passage of time. None of it has been explained as a language your cardiovascular system is speaking. By the end of this video, it will be. One boundary before the signs. These 8 indicators are signals worth knowing, not diagnostic tools. If you are currently experiencing chest pain, pressure, or tightness, pain spreading to your jaw or left arm, sudden breathlessness, or you feel faint right now, this is a medical emergency and you need help immediately. These signs are for people who feel generally well and want to understand what early cardiovascular risk looks like before it becomes a crisis. They are conversation starters with your doctor. They are not a diagnosis. Here are the 8 signs. Work through each one as we go. Several of them you can check on your own hands right now. The test you just performed is one of the first assessments a cardiologist runs when evaluating how efficiently your heart is delivering blood to the outermost points of your body. The nail blanch test measures capillary refill time, which is how quickly your smallest blood vessels refill after compression is released. In a healthy cardiovascular system, full pink color returns in under 2 seconds. A return time between 2 and 5 seconds indicates sluggish peripheral circulation and can reflect reduced cardiac output. Over 5 seconds is clinically significant. The American Heart Association identifies prolonged capillary refill as a reliable bedside indicator of compromised cardiac output in adults over 60, where the compensatory mechanisms that mask early heart dysfunction are less efficient than in younger adults. Hold your hand flat in good light and look at both thumbnails. A healthy nail shows a predominantly pink nail bed with a narrow white crescent at the very base near the cuticle. In Terry's nails, this pattern reverses. The nail bed appears mostly white or pale, with only a thin band of pink remaining at the tip. The condition was named and documented by physician Richard Terry in 1954 in relation to liver disease. But subsequent research published in the Journal of the American Academy of Dermatology identified heart failure as one of the primary associated conditions. The mechanism is reduced blood flow through the small vessels of the nail bed, sustained over a significant period of time. In the context of this list, Terry's nails matter most when they appear alongside one or more of the other signs described here. Look at the nail beds of all 10 fingers under direct light. You are looking for thin, dark, reddish-brown lines running vertically under the nail surface, resembling splinters trapped beneath the nail plate. These are called splinter hemorrhages, and they form when microscopic blood vessels directly beneath the nail rupture. A small number caused by physical handwork or a recent injury is not alarming. Multiple unexplained splinter hemorrhages across several different fingers are a different matter. They are documented in the BMJ and standard cardiology textbooks as a classical peripheral sign of infective endocarditis, which is an infection of the heart valves, as well as other conditions affecting small blood vessels systemically. Multiple unexplained splinter hemorrhages across different fingers without a physical cause warrant prompt medical evaluation. Press the backs of both index fingers together at the nail bed so the nails face each other. Look at the small space between them where they meet. In healthy fingers with normal fingertip anatomy, you should see a small diamond-shaped gap of visible light between the two nail bases. This is called the Shamroth window, and it exists because healthy fingertips taper slightly toward the tip. In finger clubbing, the fingertips enlarge and the nail curves progressively downward over time, and that diamond gap disappears entirely. Clubbing develops when fingertips are chronically undersupplied with oxygenated blood. While it is associated with both lung and cardiac conditions, it is listed in BMJ clinical reviews as a significant peripheral sign warranting systemic cardiovascular and respiratory investigation when the window test is absent. Run your fingers slowly along the back of each hand, following the tendon lines running from your knuckles toward your wrist. You are feeling for small, firm, yellowish, or skin-colored nodules sitting on or immediately adjacent to the tendon surface. These are called tendon xanthomas, and they are deposits of cholesterol that accumulate in tendon tissue when LDL cholesterol has been significantly and persistently elevated over years. Their presence is a strong clinical marker for familial hypercholesterolemia, a genetic lipid condition that dramatically elevates cardiovascular disease risk in a way that standard dietary advice does not adequately address. Research published in the Journal of the American College of Cardiology identifies tendon xanthomas as one of the most reliable physical indicators of familial hypercholesterolemia. Most people who carry this condition have been managing cholesterol numbers without ever being told that the tendons on the back of their hands carry a visible sign. In direct light, look at your nail beds and the skin of your fingertips for any persistent bluish or grayish tinge. Healthy nail beds should appear a consistent pink. Peripheral cyanosis, which is what this discoloration is called, results from reduced delivery of oxygenated blood to the extremities. It is distinct from the temporary bluing caused by cold temperature, which resolves quickly once the hands warm up. Persistent cyanosis at the fingertips in a warm room is a separate finding. In cardiovascular terms, it reflects reduced cardiac output, meaning the heart is not delivering adequately oxygenated blood to the hands with sufficient force and efficiency. Research in the European Heart Journal identifies peripheral cyanosis as a physical examination finding associated with decompensated heart failure in older adults that is frequently self-normalized by patients who have lived with it gradually appearing over years. This is not about individual temperature preference or the general tendency to feel cold. This is specifically about hands that are consistently and noticeably cold. While the room is warm, other people present are comfortable, and the temperature of the hands contrasts clearly with the rest of the body. When cardiac output declines, the body's compensatory response is to constrict peripheral blood vessels and redirect blood flow toward core organs, which leaves the hands, feet, and lower legs chronically underperfused. Cold extremities in warm conditions, especially alongside the pallor or bluish tinge described in signs 2 and 6, can reflect exactly that compensation at work. Research in the European Heart Journal documents cold extremities as a clinical finding associated with reduced peripheral perfusion in older adults with heart failure that is frequently dismissed in routine consultations as a personal circulatory trait, rather than examined as a cardiovascular signal. Find something cylindrical right now, a jar, a mug, or a tin. Grip it as firmly as you can and hold the thought of how that compares to how it felt 2 or 3 years ago. In 2015, The Lancet published results from the prospective urban-rural epidemiology study, which followed 139,691 adults across 17 countries for a median of 4 years. The researchers found that grip strength was a stronger independent predictor of cardiovascular mortality, heart attack, and stroke than systolic blood pressure. Every 5-kilogram reduction in grip strength was associated with a 17% increase in cardiovascular mortality risk, independent of age, sex, physical activity level, and tobacco use. Grip strength declines gradually over years, which is why the majority of people experiencing it attribute it entirely to aging. It is not simply aging. It is a measurable, trackable signal of cardiovascular and musculoskeletal reserve that is more predictive of your cardiac future than the number your blood pressure monitor produces each morning. Let me tell you about someone I will call James. James is 71 years old, a retired civil engineer from the north of England. Physically active, no history of heart disease, and never flagged at any of his annual checkups. He came across the Lancet grip strength study independently and decided to test himself properly. He had been quietly aware that his grip had weakened noticeably over the past 2 years, a detail he had mentioned to no one because it seemed too vague to raise with a doctor. He checked his nail blanch test and found a refill time of approximately 4 seconds. He also noticed a slight bilateral pallor in his nail beds he had never paid attention to before. He brought both observations to his GP with the specific research behind them. The resulting evaluation identified moderately reduced cardiac output that had not previously been detected because his resting ECG was normal and no one had examined his hands. He was not in crisis, but he was 2 to 3 years into a decline that would have continued undetected if he had continued normalizing his grip as aging. He had been looking at his hands his entire life. He had never been shown what to look for. If you identified one or more of these signs in your own hands today, here is exactly what to do with that information. Write down which specific signs you noticed, which hands, which fingers, and what the capillary refill time was. Do not search symptoms online and attempt to self-diagnose. Bring the specific observations to your next doctor's appointment and ask for them to be evaluated in the context of your cardiovascular history. For grip strength specifically, begin tracking it monthly with a consistent test so you have a trend to present rather than a single impression. If you notice a capillary refill time significantly over 2 seconds, peripheral cyanosis at rest, or multiple unexplained splinter hemorrhages, request an earlier evaluation rather than waiting for a scheduled checkup. Early signals that are examined, early remain early signals. The same signals ignored for 2 more years become a different conversation entirely. Here are your 5 steps. 1. Go through all 8 signs tonight on both hands in good light and write down every observation. 2. Do the capillary refill test again tonight, time it properly, and note the result. 3. Test your grip strength tonight against something consistent and give an honest assessment of how it has changed over the past 2 years. 4. If you found signs, 3, 5, 7, or 8 specifically, book a doctor's appointment this week rather than waiting. 5. Send this video to one person over 60 in your life tonight. They have almost certainly never been shown what their hands are saying. Don't forget to subscribe for more informative videos.